Quest to combat disease and improve the quality of human life has led to great advances in healthcare. And we are a privileged generation. Many of the most significant strides have been made in our own time.
As we approach the end of the first decade in this 21st century, there are indications that we're entering into a new era in health and wellness. An era that may change today's dominant healthcare culture of treating isolated symptoms without consideration of other interrelated conditions. Many medical professionals are realizing great results for their patients with coordinated multidisciplinary care.
There's lots of different ways to treat a chronic pain patient, and there's many different types of doctors from many different fields that treat chronic pain. And it's not that they do anything wrong. In fact, my belief is that they do everything right. But there hasn't been a coordinated effort for all those folks. There hasn't been a coordinated effort between the psychologist and the physical therapist and the interventional technician, the surgeon, the physiatrist. All these are important elements of treating chronic pain successfully, but if you don't bring those together in a coordinated fashion for a sustained period of time, the body doesn't have a chance to heal and you ultimately fail. What we do at the Alabama Pain Center is we coordinate all of those wonderful therapies into one therapy, and we see dramatic successes. We see miraculous things happen, and there's hope for the hopeless.
The specialty of pain management has been one of the most rapidly growing areas of medicine for the past 10 to 15 years. Improved ways to diagnose sources of pain and innovative treatment approaches have helped countless people realize an improved quality of life with effective management of their pain. For many patients suffering from a wide variety of conditions, such as the chronic pain associated with cancer or other severe illnesses, to those experiencing debilitating back or joint pain, or even migraine headaches, a comprehensive multidisciplinary approach to treatment is providing them with a new lease on life. Specialists such as Dr. Dean Willis and his peers at the Alabama Pain Center in Huntsville are helping patients break free from the stranglehold of chronic pain.
Well, it's pretty simple. You basically approach treatment of pain from a multitude of different directions. I think most pain centers nowadays rely primarily on block therapies. In the old days, they relied primarily on physical therapy or even some psychological support, which was at best incomplete. Many of the therapies nowadays are much more effective if you coordinate the care between those three modalities, and we do that here at the Alabama Pain Center very effectively.
According to experts, there are over 800,000 new chronic pain patients each year, and more than 50 million Americans live with some form of chronic pain. At a comprehensive pain management facility, there are many professionals who fight the effects of pain. Pain doctors, primary care physicians, psychologists, physical rehab specialists, all working together to coordinate customized care for a wide variety of pain patients.
I went to the Alabama Pain Clinic as a result of complications from gastric bypass surgery and multiple surgeries thereafter. My physician referred me to Dr. Willis, and I was actually in the hospital whenever I first met him. He came in late one night and he was amazing, and he gave me so much hope. And I went to the pain clinic. I was still skeptical of the process because I'd been through so much, but they have so many people there to help you, and they treat you mentally, physically. They have physical therapists, they have regular physicians, they have psychiatrists, they have a whole range of people there to just take care of you.
My privilege is to work at the Alabama Pain Center, where we take a multidisciplinary teamwork approach to help patients get better and stay better. My goal is to help patients realize that even though they have physical pain, suffering is an option.
Okay, June of '95, I got hurt on my job, and from that point I was seeing multiple doctors and couldn't get no pain relief. And I said right then to myself that something got to be done. And from that point, it led me to the Alabama Pain Center under Dr. Willis, under the care of him. And my pain level was 10 out of 10. They done brought it down from a 10 to a 2 out of 10. And now I got my life back. I can play with my grandkids and nieces and nephews.
To learn more about the Alabama Pain Center, you can find them online at www.alabamapaincenter.com or reach them by calling 1-256-881-PAIN.